Welcome to Square One Health, where your journey to a pain-free life begins. Frequently, having a pain-free spine begins with having the proper alignment in your back. Hi, I'm Dr. Chris Gubles, and today I'm going to be talking about how we determine how much curve you're supposed to have in your back and how we go about correcting it if you don't have the amount of curve you're supposed to. Now, as I'm going through this, if you like this information, be sure to give us a thumbs up and leave any comments below with questions you have or other topics you would like me to discuss. Now, determining your proper alignment all comes down to doing a detailed evaluation where we measure something called your pelvic incidence. Basically, we do a detailed digital analysis of your spine on an x-ray, and we can determine how big your pelvis is. The size of your pelvis will determine how much curve you are supposed to have in your spine. Now, if your lumbar curve, or we call your lumbar lordosis, does not match your pelvic incident, which is basically fancy words, meaning if the size of the curve in your back doesn't match the size of your pelvis, that's a problem. Whether you have too much curve or too little curve, those both frequently cause back pain. Now, having a loss or not having the normal curve in your spine is more frequently associated with having chronic and even debilitating back pain. And more commonly, having too little curve in your spine is more often associated with chronic or even debilitating back pain. Now, once we determine how much curve you should have in your spine and how much curve you actually have in your spine, then we can go about correcting the problem and restoring your body to proper alignment. Now, this is done with 3 different methods within chiropractic biophysics. Now, once we determine what your alignment is in your spine and how much alignment you're supposed to have, then we can put together a customized program using chiropractic biophysics to reshape your spine back into its proper alignment. Now, there's 3 main steps to this process. The first one is doing what we call mirror image adjustments, where we're actually doing adjustments with your spine in a corrected or overcorrected position. 2, we do mirror image exercises, where we actually rehab and exercise your spine back into a correct position. And the most important is what we call mirror image traction. Now, in mirror image traction, we reshape and remold your spine back into its proper alignment by holding your spine in a corrected position for a period of time. And little by little, the spine will reshape back into its proper positioning. Now, once we have your spine alignment corrected, we want to strengthen and stabilize your spine using specific strengthening and stabilizing exercises or physical therapy. And then we'll combine that by giving you things to do at home to also work on reshaping your curve or using what we call a general home traction device. So if you're dealing with chronic back pain, find a certified chiropractic biophysics provider or an advanced certified chiropractic physics provider to get your spine properly evaluated to see if you are out of alignment. And if you are, what can be done to reshape your spine and get your body back into proper alignment. Now, if you like this information, be sure to subscribe to our page so you can get notified when we have our next video showing you what could be causing and how to correct back pain.